A very good morning, everybody, and welcome to the AM MedTalk series that we have been doing every Sunday at 11 a.m. With all of you. It has been absolutely great for me to be connecting and interacting with various aesthetic medicine practitioners on the AM MedTalk Live. Today, also, we have a very special guest with us, Dr. Niti Gaur, and this is the first time I would be going live with Dr. Niti on the Aesthetic Medicine Instagram page. So I can see that Dr. Niti has already joined us. So I will quickly add it in before we continue. All of you are regularly downloading or using our digital edition of the magazine to know everything that we are putting out there for you all. Dr. Niti, I have accepted your invite, so I think within a couple of seconds you should be with me in the live. Yes.
Hi, Ishwar.
Hello, Dr. Niti. Good morning.
Good morning. How
Thank
are
you
you?
so much for joining us on this live. I'm doing great. I
Sure.
hope you're doing well too.
Yes, absolutely.
Great. So, for everyone joining us on this live right now, let me tell you that Dr. Niti Gaur is joining me from Gurgaon, right, Dr. Niti?
Yes, from Gurgaon,
Yes,
yes.
she is an MD fellowship in cosmetic dermatology, Singapore, USA, a board certified dermatologist, and the founder of Citrine Clinic in Gurgaon.
Right.
Great. So, today, Dr. Niti and I have come together for a very interesting conversation on skin tightening, but skin tightening without needles. So, I think this is going to be very interesting. Very recently, Dr. Niti, we did a live on where we spoke about injectables and all of that as well. So, the whole idea of AM Med Talk has been to like look at different facets of aesthetic dermatology and how can we excel in the practice, in different ways. So I think today is going to be yet another new topic for you
Yeah.
and me to
And,
discuss.
and, and this is a very important topic because considering that, needles is something that really scares some people. We're, of course, becoming very aware now, and there are more people coming in for procedures with fillers and etc. But then, energy-based device is something that needs to be understood a little better for people, especially who figure that it's only fillers that is an option to do anti-aging treatment. So we can understand this better to understand there are other non-invasive options.
Right, right. I have a comment that pops up saying that she's such an amazing doctor. Thank you, Ashish Diksha, for the
I'm humble.
comments.
I'm humble.
And please, everybody watching us live, I know I always come with my set of questions, which is right in front of me. You're ready for Dr. Niti, but feel free to use the comment box. That's why I keep it open. Do ask your questions as well. We will definitely take whatever is possible for us to take during this live, and the rest we would respond to them once the live is over. And nevertheless, we save the live. So I think it's very good food for thought even after the live for you to go and watch it again. So having said that, Dr. Niti, shall we begin?
Yes, please let's.
Superb. Okay. So I think I would like to begin this, like you mentioned, that a lot of your clients or patients have that fear towards needles, towards using needles. So if I have to begin with myths and misconceptions, what are the most common myths or misconceptions that you hear from your patients regarding non-injectable skin tightening treatments?
See,
We know there are a lot for
most,
injectable,
yeah,
but we want to know about the non-injectable
yeah.
side.
So most essentially think that it just doesn't work, which is not true. That is something that is the biggest misconception that I feel that, I come across. That and for a lot of people, they also seem to think that this is something that will eventually need to be combined with another intervention. And very frankly, that's not true for most cases if done properly. And actually to be able to answer this better, we need to understand that when we talk about aging, we need to understand how aging happens. So if you suggest the right modality for the right aging mechanism that is happening, why wouldn't you get a result with the energy-based device? So essentially, picking up the right intervention for the right indication has to be the treatment line.
Right. If we talk about in terms of effectiveness and results, how do non-injectable skin tightening treatments differ from injectable treatments?
See, injectable, we're going deep down, right? especially fillers or threads. We're actually going deep down. We're actually looking at replacing the volume loss that has happened. We're actually looking at actually repositioning the fat loss that has happened with threads. Now, in this, you're not actually penetrating deep, but you're stimulating a natural repair mechanism, a stimulation mechanism in your own skin to produce collagen, and thereby helping and assisting your own skin to be um, leading to symptoms and the look of anti-aging. So more plumpness, more firmness, better elasticity, improvement in skin texture, because you're actually stimulating your own skin to do that. When you're talking about invasive, you're assisting it externally. So there is a difference, you know. When you're talking about injectables, you're injecting a product or you're putting a thread there, and that will have a certain life. When you're doing something which is energy based, device based procedure, that is going to stimulate your own collagen production, so your cells will remain active for a longer period. And actually speaking, this is more of preventive aging, you know, so this is the right anti-aging that we actually should say.
Hmm. Uh, how about specific skin types or patient profiles? How do you decide that, where you would recommend a non-injectable skin tightening treatment?
If the patient is scared of an injection, I would always suggest them to take up an energy-based device treatment first, get comfortable, you know, because once you start seeing the results, you're reassured. You're more open to going to the next step. And of course, for a youngster, see, aging is a term. Aging is not age. Aging is a term. You know, stress itself, because of our lifestyle and stress, we're seeing aging actually coming in 10 to 15 years earlier than what we used to see in our earlier generation. So it's not about 40s or 50s or 30s. It is about when I start feeling that my repair mechanism of my skin, my tissue is slowing down, I assist it. So for a youngster, yes, definitely an energy-based device approach. And if needed, of course, if you need, if there's volume loss, you know, you're gymming or you've had a lot of stress and there's been volume loss, why not an injectable? But yes, to begin with, an energy-based device. And for actually most people, we can always stimulate our own cells, right? We can
Yes.
always stimulate our own cells and then we can always assist them externally in other ways. So for a youngster, yes. And for most people, I would say take few sessions of an energy-based device first and then go in for an injectable option.
I will quickly take a question from the comments. It's from Ankita Suri that what's the best time to consider non-injectable treatments for anti-aging?
So like I said, for a youngster, so maybe your late 20s and 30s, when you're actually looking at preventive aging in the right sense, when you want to keep your cells active so that they continue to produce collagen, we can delay aging, that is definitely the right time to consider.
Hmm. Okay, I'll quickly jump on to a few techniques now. So when we speak about radio frequency or ultrasound-based techniques, how do these contribute to skin tightening and how do they differ from each other?
Hmm. Now that's a very nice question because see, in most clinics, like in my clinic also, we will have a monopolar radio frequency and we will have a high intensity focused ultrasound. Now, see, both of them are actually going to stimulate collagen production. They're both energy based devices. The difference being monopolar radio frequency is more superficial, you know, so it's more for where there is superficial volume loss, where you want to plump the skin, where you want to improve the texture. And HIFU is high intensity focused ultrasound. It is deeper, so it actually goes to the deeper layers. So when you're looking at superficial skin texture, fine lines, wrinkles, that is where you would consider monopolar RF. When you want deeper penetration beyond the dermis, into the deeper layers, where you want firming of the skin in terms of lifting and improving the sagging appearance, that is where you would consider high intensity focused ultrasound. And you know,
Hmm.
a lot of times you actually combine the both.
Okay, we can combine the both also. So these are two techniques, of course, that you beautifully touched upon. Any other techniques that you would like to mention over here, doctor, when we talk
Oh
about
yes,
non-injectable skin
oh yeah,
tightening?
oh yes, lots. So of course, RF tightening, high intensity focused ultrasound. We have fractionated CO2 fraction lasers, you know, which also causes micro injury on the skin, which will help the skin get into a process of tissue remodeling and hence improvement in collagen production, skin texture, etc. Microneedling radio frequency, which is combination of microneedling with radio frequency, which again is also going to create micro injuries on the skin tissue and then stimulate collagen production.
Hmm.
PRP,
Hmm.
platelet-rich plasma therapy, which is your own blood, your own growth factors from your own platelets. And of course, fractionated Q switch laser, which uses short pulse Q switch to actually break the pigmentation. And it's more for improving texture, pigmentation, and as a secondary phenomena helping collagen production. And the newer modalities, which is exosomes, PDRNs, polynucleotides, there is lots that actually can be done.
Nice, nice. So I'm quickly taking one question from Megha Gaur. Of course, this is to do with injectables, but the reason I'm taking it up is because we did speak about myths and misconceptions right at the beginning. Her question is that do injectables have any side effects?
The new injectables that we've been using for about a decade now, uh, if you asked about the product, no, there are no side effects because it's natural hyaluronic acid or natural substances that we're using. But it depends on the trainer. It depends on a trained injector. So your doctor should have been trained properly and should know the anatomy well, and you should get it from a qualified dermatologist or plastic surgeon who've been trained extensively to do these procedures for you. So then there are no side effects. So there are no
So,
product related side effects. It's more about the person doing related side effects, if at all they happen.
so I would really like to mention, this is something that we at Aesthetic Medicine India also advocate that only go and get treatments done from certified dermatologists and certified practitioners, be it injectable or non-injectable. So I think here it is also important for the doctors to educate their clients and patients when they come that either you could be a client coming to the same doctor again and again, or at any point you relocate, whatever reason you decide to shift your doctor, but it should always be a board certified one.
Absolutely.
So
And
yes.
see, it always takes time to understand the skin also, no? Like when I, supposing if I was to talk about injectables for a moment, so when I'm injecting, I always underdo it. Especially for someone I'm working on for the first time, I always underdo it. And then I understand your skin. And then gradually we build it up, because you want to give natural looking results. So that is why it's always
Hmm.
better to get it done from a qualified doctor, stick to one doctor, let your doctor do the best for you.
Yes, picking from there, I'll go to my next question that I think I always discuss this with doctors, patient expectations. So when it comes to the timeline of the treatment or the results, I think that is always something you have to deal with. I wouldn't call it a challenge, but I would call it a very important part of your practice actually, where patient satisfaction comes from. So how do you manage your patient expectations when it comes to, the results that have to show, the time frames within which they would show, and especially since we are talking about non-injectable, which is faster, like other non-injectable skin tightening treatments, do they give faster results or is it the injectable ones? And how do you deal with this when you are suggesting a non-injectable skin treatment to your client?
So injectable is always going to give a faster result because you're actually going to, like for a filler, you're actually going to fill it up. So it's going to be visible immediately. And of course, it's going to build up with water absorption and all of that. It's going to build up. Now, when you're talking about non-invasive and other, non-filler based modalities or non-thread based modalities, we're actually waiting for your own tissue to start producing collagen. We're waiting for the skin on its own to go into a repair mode. We have stimulated that process with the energy based device, and we are now going to wait for the results. Yeah. So now, typically, when you get the session also done, because there's a certain inflammatory process that is initiated immediately. So you will feel a certain plumpness even then. But that's going to gradually build up over the next few months. Starting from this about 1 to 6 months, it's going to look better. And with injectables, it's immediate. And over next 15 days to 1 month, that's when you see the final result.
Right, right. And how do you approach your patients? Like, how do you deal with them? A lot of times, I'm sure you would have patients who want like a very quick result, but at the same time, maybe for whatever reason, you may recommend a non-injectable skin tightening treatment to them. So, how is your entire process when it comes to patient approach?
See, um, if you have something that is important, like a social event, which is in the near future, that's about a month, I would never suggest you to go in for an injectable option. Yeah.
Okay.
I'd rather combine or give you more sessions or maybe combine um, one or more energy-based or other non-invasive anti-aging options.
Mm.
Because every injectable treatment would have its downtime. You may bleed, there could be a bruise, there could be it may take time for collagen to settle, for the product to settle. So there could be uneven appearance for a while.
Mm.
But with energy-based devices, you fortunately don't have these kind of downtimes. So if somebody wants a quick fix or they're working on a certain short frame time framework by future line, then I would suggest going in only for a non-injectable option, which does not have visible downtime effects, in terms of bruising or uneven appearance, etc., or asymmetrical appearance.
Mm.
So in that
Mm.
case, yes, but if you give me time, then I would like to first start with an energy-based device and eventually take you on to an injectable.
Right, right. We did speak about a few techniques that you elaborated upon and touched upon, recent techniques. Any other recent advancements or something that is right now trending out of India and you see it coming to India soon in terms of treatments and you see it significantly impacting your practice in a positive way? So, any recent advancements that you would like to talk about?
Exosomes,
Yes.
PDRNs, and polynucleotides. So I cannot completely say this is not coming to India yet. Some of us have brought it here. We've been seeing it outside the country for about a year or two now, and we've also brought in now. Some of us have brought in. This is something that is going to pick up because this also is essentially like PDRN is a DNA based treatment modality that you're picking up. So this is something that is going to help your own tissue get into it's a substance that will help in your own tissues healing. So,
Mm.
anything that is going to heal your own tissue and which is going to be DNA based, cell based approach is always going to have a more lasting impact. So this is something that is, where we've begun to now do it. Not so much as yet, but yes, we've begun to do it now.
So I remember when we did the Aesthetic Medicine India conference 2 years ago, like last year, we were speaking about exosomes, something that is being practiced in the West, and what a good treatment and PDRN and all of that. And that time we were talking about soon we could see it coming in India. And I think when this year we did the conference early this year in May, we actually saw now doctors have started using it in their practice. But of course, I can see now with this 1.5 year, it's just one more year to take where these treatments are going to kick off in a big way. And the benefits seem to be outstanding for patients. But,
Absolutely.
doctor, help me understand when such new treatments get introduced, is there any specific kind of trainings that, even doctors like you who are already
Of
board certified, do you all
course,
undergo? Like they
of
say, there's
course.
never end to learning.
Absolutely. A doctor never stops learning. So we're
Yes.
always upgrading our knowledge. We obviously, when we go for our international conferences, something that has not come into India, we make ourselves aware of it, then we study about it. If something is, we have an option to get trained here, then we'll do that. Otherwise, we go abroad and we get ourselves trained before we actually start doing these procedures. Without training, no, never. None of these, because ultimately you're dealing with humans. You have to be trained. You have to
Of course.
understand it completely. You have to get trained. You have to improve on your skill, and then you eventually start doing it.
Right. I think that's again a good message we are leaving for doctors as well as the patients who look forward to getting such treatments done. Now let's come to post-treatment care. Like, of course, we've discussed a lot about how you assess your patient. How do you get these treatments done? How about post-treatment care? Because these equally play an important role. It's like they make or break the entire process if not done properly. So, what post treatment cares do you typically recommend when it comes to the non injectable skin tightening treatments?
See, now it depends. It depends on what I was looking at in the first place when I started the treatment for the patient. So, if let's say, so when we, like I said, when we're talking about aging, there are three different levels. No? So there is volume loss, then there is loss of collagen production, and then there's skin texture. So depending on which device I picked up for which indication or a combination of indications, I would give my instruction accordingly. Two instructions that I would never miss is putting your sunscreen and putting a moisturizer at bedtime. I would never miss this. And
Hmm.
all my other instructions would be dependent on what I treated. Supposing if I was looking at skin texture, then I would add a retinol based. And if I wanted more repair, like I did an invasive sort of invasive modality like a CO2 fractional laser or a microneedling, then I would add a ceramide based moisturizer in addition. I would add a retinol. I would add something for skin lightening. I would probably give oral collagens also in addition. So it depends on what I was treating, but two things I would never forget is a sunscreen and a moisturizer.
Right, great. Okay, I'm quickly taking one question from Ankita Suri that if we undergo an injectable treatment now, will the skin sag more in the 60s and 70s compared to if we hadn't had the treatment done?
No, I need to understand that again. Sorry, let me know that
Yeah,
again.
that if we undergo an injectable treatment now, will the skin sag more in the 60s and 70s compared to if the treatment was never done?
No, no. So, Ankita, this is something that we need to, this is a myth, and we need to clarify this. When we're injecting, we're actually injecting natural hyaluronic acid. Its job is only, it's a gel. Its job is only actually essentially to absorb water. But when we're injecting, it is also stimulating certain collagen production in your own skin. You know, so it's never going to be so, but your process of aging is going on even after you have injected. You cannot blame the injectable for the sagging to happen. It's just assisting, it's just absorbing water and assisting it there. So whether you do it or not do it, your aging mechanism is going on. It's only replacing a certain lost tissue over there, and it has a certain life. After the enzyme breaks it and it gets removed from your body, it has got nothing to do. So your aging process is separate, you injecting a particular product is separate, and that is not going to affect your sagging.
Yeah, so I hope we've got that answered for you. And there's a very heartwarming comment for you, Doctor. I'm going to read that out. This is from Anubhav Nayak that it's been almost 9 years of knowing Dr. Niti, and no matter what, I always come back to her for my skin concerns. The way she understands her patients, no one does. She's the best doormat.
I'm humbled and I hope I can keep up the faith. Thank you.
And it feels so good when I get doctors live and I see these comments, when I know I'm getting the absolutely, I'm managing rather to get your time and the right doctors live with me
So
because I
humbled.
know you all are
So
so
humbled. It's such
busy.
a
And
pleasure. Such
yeah,
a
and I
pleasure.
think there's a strategic reason why I have chosen Sundays for the live because I know your weeks are totally jam packed with consultations.
You were smart.
Okay, so I'll come to my last question now, and of course, any more questions for Dr. Niti, now is your time to put it, else we take it offline. So of course, you did speak about how do you decide when do you go in for a injectable or a non-injectable treatment for a patient, or what are your factors to consider? Can you give us any specific case in your experience where you clearly made the choice of going in for a non-injectable skin tightening treatment and why?
I do this all the time,
Oh,
especially for youngsters, all the time, all the
ah.
time.
So when you
You
say
know, and
youngsters, any
yeah.
particular age group over here?
No, see, because fortunately, with social media's influence in the last 3 years since COVID came in, it's become much easier for us also to actually speak to people. They're actually approaching us on their own, looking at aging, preventive aging, skincare, and etc. So when we're able to identify early signs of sagging or volume loss coming in, or some textural changes coming in because of which are actually age related,
Mhm.
like aging
Mhm.
related, would rather suggest it to a youngster to do the right treatment there and then. No? And
Yes, absolutely.
uh, it's not that as a doctor we insist on every patient to get an injectable thing done. We have to suggest the right treatment for the right indication. So if I see a youngster with early signs, I will always tell them to get an energy-based treatment, and that is what I do in my practice all the time.
And this is always case to case basis. It can't be that one size fits all. I'm sure you might be having this experiment this experience that you treat a patient and then they get someone along the doctor, they want to do the same thing what
No,
you
no,
did for.
never. What is going to work on my skin is not going to work on yours, even in the same age bracket. My life is different, my stresses are different, yours are different, your body is different. Skin is also an organ of our body. Like
Of
every
course.
other organ, it's also going through certain changes. So has to be very customized and very individual approach to each and every one. Even with two sisters, you cannot have the same approach.
Yes, yes. Okay, I have a question from Dr. Rishika Jaiswal. She's requesting if you can share some more information about exosomes.
So, see, exosomes are they are like messenger molecules. Okay, they are going to transmit information about repair from one cell to another. The purpose of which is to actually assist your own skin to repair, to stimulate collagen production, and to initiate an entire healing process that is going to come in over there. Now, this is something that you can use for your skin and for your hair. So we're using it in both, domains. We're not just doing this for skin rejuvenation. We're actually using it for treatment of hair fall also.
So I hope that has answered the question. We have a question from Chavi, but Chavi, I'm not taking this question now. It's on general measures that can prevent signs of aging because I think the doctor has already responded to it in the live. So what I will do is we will now save this live and definitely you can go through it so that you have the answer to your question. But having said that, I think the time has come for me to thank Dr. Niti Gaur for her time. Thank you so much, doctor, for joining us and was an absolute pleasure interacting with you.
Same here. This has been a lovely Sunday morning interacting with you, Shreya, and with
Same here.
everyone. And looking forward to more sessions with other doctors also. This is very interesting.
Definitely, and I would also look forward to you being with us during our annual conference. It's going to be in May
Done thing.
next year, and it's going to be very exciting. We every year we try to introduce new things into the conference we do for aesthetic medicine practitioners. What initially started with simple, panel discussions, now it's gone on to live demos, workshops, scientific sessions. We do panels. We have an exhibition area. So all of it coming up in May again. We always do it around May, June. So next year we're scheduled for May. So definitely we will stay connected. And I know Dr. Niti and I are going to go a long way with bringing a lot of information
Looking forward.
in the aesthetic
Forward.
space.
Totally.
Thank you so much, Dr. Niti. And
Thank you,
for
everyone.
everybody watching me, this was Dr. Niti Gaur, dermatologist from Gurgaon. And I am Shriyal Sethumadhan, the editor of Aesthetic Medicine India. And now we sign off for the day. Have a great Sunday and have a great day, Dr. Niti. Thank
Take care.
you. Bye.